So another way of trying to monitor a patient's BP throughout a day is what is known as what? Not really BP, trying to monitor their heart activity. All right. So their heart activity, like you're trying to check out for their heart activities. Another way of doing this is what is known as what? Holter monitoring. Okay. And to me, this Holter monitoring is like a type of what? Ambulatory type of ECG. Okay, so you could just put it permanently while the patient just wear their shirt normal and they go about the day, because sometimes there are some heart problems that are just coming up that you may not be able to dictate when the patient is in the hospital. So you could just put them this type of ambulatory ECG so that maybe they go to work, they go to parties, they go to everywhere with it, all right? So that when those bad arrhythmias start coming up, you can actually pick it and you can basically go and see the patterns of those arrhythmias, okay? So one of this is Holter monitoring. So take um, we'll read about it and see how it is applied. So I think this Holter monitoring is a non-invasive diagnostic test that records the patient's heart rhythm over a period of what? 24 to 48 hours. The purpose is to diagnose arrhythmias. You're trying to pick up um, the times that the heart will start beating abnormally, because sometimes this thing is not consistent. So for you to be able to pick it up, the person has to be monitored for a whole day or even 2 days or even 3 days, right? So you want to monitor some cardiac symptoms like palpitations or dizziness. You want to evaluate how the pacemaker is functioning, that's the SA node. Then you're trying to what? Access anti-arrhythmic medications effectiveness. That's probably some patients, they have already been diagnosed with the condition, so you are trying to treat them. So now you're now trying to see how they are picking up, right? Then you want to also identify silent arrhythmias. Some patients will complain that they have this. When they come to the hospital, they are looking very normal. Their heart is beating normal and all that. Okay, so you want to pick up these arrhythmias that are just coming up, right? Procedure: you actually place small electrodes to the chest. These are the electrodes we are talking about, the blue stuffs. Then a portable device known as a Holter monitor records the ECG. The patient will now keeps the patient keeps diary of activities and symptoms, right? Then the monitor can be removed after 24 to 48 hours. Data can be analyzed and reported. All right. So the types of Holter monitor have the ones that could be for 24 hours, have the one that could be 48 hours. We have the one that is extended up to 14 days. Then we have a mobile cardiac telemetry. All right. Indications: that's some types of complaints that the patient will have that will actually what? Compel you to doing this type of treatment. So if they complain about syncope, that's fainting, or near syncope, that's near fainting. All right. If they complain about palpitations, complain about dizziness, they complain about shortness of breath, if they complain about chest pains, if they complain about any arrhythmia symptoms, all right, you can just give them that so that you can monitor them throughout the day. Benefits: there's an accurate diagnosis, it is just outside, so it is non-invasive. There's a you can do it for a prolonged time. Okay, then you can correlate symptoms with what? ECG. Limitations: skin irritations could actually come up from the electrodes. There's limited duration. There's interference with external source, that's electromagnetic field. Okay, so that you could be having some false results, right? And patient compliance is actually what required, right? So that's it for Holter monitoring: purpose, procedure, types, indications.